How do you spot a bleeding stomach ulcer? Imagine feeling a sudden, intense stomach pain that doesn't go away, and then noticing some alarming signs that something might be seriously wrong inside. A bleeding stomach ulcer can be dangerous, so knowing what to look for is crucial. The most obvious signs include vomiting blood, which can look bright red or have a dark, coffee ground appearance. This happens when blood from the ulcer mixes with stomach acids and partially digests, giving it that distinctive look. Another key sign is passing black, tarry stools, known as melena. This occurs because blood from the ulcer travels through the digestive system and gets broken down, turning the stool dark and sticky. Sometimes, blood may be visible in the stool, either bright red or darker, depending on how much bleeding is happening and where it's coming from. If the bleeding is significant, you might notice symptoms of blood loss like feeling very pale, extremely tired, or short of breath even with minimal exertion. Lightheadedness or dizziness can also occur, especially when standing up quickly. Severe blood loss can lead to shock, which might cause a rapid heartbeat, low blood pressure, confusion, or cold, clammy skin. In addition to bleeding signs, severe abdominal pain or tenderness can be a warning. If the ulcer erodes into a blood vessel, bleeding can become rapid and life-threatening. That's why immediate medical attention is essential if you experience vomiting blood or notice black, sticky stools. Do not try to drive yourself to the hospital if symptoms are severe. Call emergency services instead. Stomach ulcers are open sores on the stomach lining, often caused by infection with Helicobacter pylori or prolonged use of non-steroidal anti-inflammatory drugs. When an ulcer erodes into a blood vessel, bleeding occurs. Diagnosis usually involves an upper gastrointestinal endoscopy, where a doctor inserts a thin, flexible tube with a camera through your mouth to see the ulcer and bleeding source directly. During this procedure, they can also treat the bleeding by cauterizing or clipping the vessel to stop the hemorrhage. Remember, not all ulcers bleed. Some cause only stomach pain, nausea, bloating, or weight loss, but these symptoms alone don't indicate bleeding. If you suspect a bleeding ulcer, seek emergency medical care immediately. Recognizing the signs early can save lives, so always prioritize prompt evaluation and treatment from healthcare professionals.